Psoriasis is a systemic inflammatory condition which mostly affects skin, but not exclusively. Also, it can affect nails, it can affect joints, and there is a link of metabolic syndrome in patients suffering from psoriasis. Just saying a bit more about metabolic syndrome, that's a constellation of conditions which mostly includes diabetes, high blood pressure, obesity, increased lipids and cholesterol in patients' blood that pose a link to them for develop later on cardiovascular diseases. So breaking down psoriasis and skin, the classical form of psoriasis presents as the red, mostly well-demarcated patches and plaques which are scaly. And the most common sites which are affected are scalp, elbows, knees, and lower back. Psoriasis mostly starts in majority of patients in 20s and 30s or 50s and 60s years old patients, but of course it can start as early as in childhood and later on in adulthood. Psoriasis is caused by genes, so person needs to be genetically predisposed. There have been so far 9 identified genes. All of those genes have different penetrance and expressivity, which means in layman's terms, genes can express themselves either early in childhood or later in adulthood, and they can cause mild or severe disease. That means that if the person is carrier of a gene, does not necessarily get psoriasis, or it gets it later on in a life and it may be very mild. Or opposite, it may start early in the childhood and it may become already severe from the beginning. Now, the next topic would be the trigger factors. So on one hand, we are talking about being predisposed for psoriasis and being carrier of a gene, but that's only one condition to get disease later on. The second condition are triggering factors, and among those, we know that psoriasis may be triggered by infections, medications, obesity, alcohol intake, smoking, trauma, and others. So when we are dealing with patients with psoriasis, we try to address those triggering factors and see if there is if there's any trigger factor playing a role in recent flare-up of psoriasis. As I already explained, classical form presents with red, scaly, and well-defined plaques, but also psoriasis can look like very discrete patches. Sometimes patients develop pustules on hands and feet or widespread on entire skin. Psoriasis can also affect oral cavities, specifically the tongue is affected. It may affect nails, which become yellowy discolored. They can develop pittings on its surface and they are crumbly. And also it can affect joints. Most commonly affected joints are finger joints and toe joints, although bigger joints may be affected as well, so elbows, knees, and so on. There is also important to know that psoriasis can appear on damaged skin. And as the damaged skin, I mean burns, sunburns, places of tattoo, the areas of piercing, scars, and so on. We would call this phenomenon Koebner phenomenon. So in many cases, patients who may have psoriasis for a long time, which has been in remission, so the skin is in good condition, they come back to the clinic and saying, I've recently been burned and I've got psoriatic patch on the side of the burn. So stress is one of the most common trigger factors for psoriasis. People who are suffering from psoriasis are very commonly stigmatized. They avoid social contacts. This affects their mood, which thus perpetuates a vicious circle. So addressing the stress factors is an important part of consultation. We have different options to offer to patients. Most commonly, we would start with topical preparations, which are combined with topical steroids, and then salicylic acid, coal tar, arthralin, and derivatives of vitamin D and vitamin A. The next treatment options is systemic options. So we would offer patients tablets, which can be initiated in a hospital settings for the purpose of monitoring of patients' blood. We also use UV rays for treatment of psoriasis, and we would use UVA or UVB, which are specifically targeted for psoriatic patients, so they don't cause a lot of damage, but they cause more of the benefits. And then last but not least, biologic treatments. Treatment is a big group of drugs which has been recently developed, and they're immunomodulating agents, which means they interfere with a mechanism of psoriasis, and therefore the outcome of the treatment is very good. Importantly to know is to address triggering factors. So reduce the stress, working on stress relief methods, for example, yoga or meditation, cut the smoking and drinking, maintain proper weight, eat balanced diet with a lot of omega-3 fat, and also use moisturizers, and among them moisturizing ointments, preferably over moisturizing creams. So psoriasis, as it presents with red, scaly and thick patches, means that the barrier function of the skin is decreased. That means that patients are losing proteins with a desquamation of the patches and plaques, and also they're losing water because plaques are inflamed. That means if they put the layer of the ointment on the surface of the skin, they replenish this barrier function, which can actually help with psoriasis in general.